Ibom, the best place to be. Welcome to Akwa Ibom, the promised land. I discover Akwa Ibom, a peaceful people. So you are welcome to Akwa Ibom. Come on, I'm coming.
I want to go home. I'm from Akwa Ibom. In case you don't know, Akwa Ibom,
welcome to the new Akwa Ibom State. Today, through God's divine mandate, Akwa Ibom is blessed with Governor Udom Emmanuel, who is committed to the industrialization of Akwa Ibom State, passionate in human capacity development and empowerment, creative in the area of agriculture, reliable in superior infrastructure, and focused on the Akwa Ibom project. Be part of the winning team. Come, let's build Akwa Ibom together.
The progress of this state lies in the unity and love we show to one another.
Upon his assumption of office as governor of Akwa Ibom State on May 29, 2015, Mr. Udom Emmanuel set sail with a mindset to alter the status quo, change Akwa Ibom from a civil service-oriented economy to an industrialized one. Hence, his clarion call on all indigents to, in his words, rise to chart a new course. That new course involved altering the mindset from a laid-back people to a self-reliant, enterprising people who take their destiny in their hands. To be able to do this, the people must be healthy, as there is a correlation between health as a factor and the economy of any society. Having realized that health is wealth, good leaders all over the world commit huge resources to achieve optimum health for their people. Mr. Emmanuel falls into the category of leaders that believe that the health care needs of the people must be accorded top priority. This could be seen in the huge investments in primary and secondary health care sector in the state. Governor Emmanuel's commitment to people-oriented governance and sustainable development in Akwa Ibom State necessitated the slogan, working beyond the promise. A few days into his tenure, Governor Emmanuel headed straight to the St. Luke's Hospital Anwa, where he gave the hospital a massive facelift, in addition to a brand new administrative building named after Dr. Anne Ward, an Irish female gynecologist and Reverend Sister who once worked in the hospital. Two other buildings were completely renovated, including a gynecology block and male ward. The internal roads were constructed and perimeter fence renovated. This feat was completed in a record 70 days in office. Today, the hospital, which was established in 1937, wears a new look, courtesy of the Governor Emmanuel's magnanimity. This is despite being a missionary hospital.
Whenever I drive through this road, I look at the admin block and that male block. At times you see a patient sitting on that balcony. And I will say, well, God, the day you give me the grace, I'll touch lives here. And immediately, I took over the administration of this state. I was sitting in my office one day. It struck me in my spirit. He said, I hope you still remember her. St. Luke's is at that same critical stage. So I stood up I called the SSG, and by the special grace of God, the distinguished senators were with me that day. We said, let's have a look at the facilities in that place. Two things actually brought me here. Number one, the fact that this had been the foremost, if you check, gynecological, I think pediatrics, am I correct? Center. And it wasn't just for Eastern Nigeria, but both Eastern and the South. So many great men in this country that have met me after our visit at the bishop. I think was shown on TV. I received several calls. People were calling, expressing, their delight that we at least will remember this place of their birth. So we had to pay that visit that day. We had a look at the facilities. We had a look at the ravine. Immediately we left. In less than 2 weeks, the School of Nursing was almost inside the ravine. I said, well, they say the steps of the righteous are ordered of God. Because probably, if I wasn't here that day, I could have probably been able to see the magnitude of the menace of that ravine. I think when I was told, we intervened immediately. And I learned today, people can still go through that place. The life of every Akwa Ibom person is as important to me as the life of any other person. So that's why I believe that we must intervene, especially if you look at Uyo today. We don't have any general hospital in Uyo. So this can serve temporarily as a general hospital for you. I intend to collaborate with the Catholic Church. I said so from day one. I'm not interested in a change of name. Let it carry the name St. Luke's Catholic Hospital, I don't mind. But let the facilities inside here be St. Luke's International Medical Center. And that will make the whole lot of difference.
You have done so well, and the people gathering here are all praying for you and your administration. You don't need to go asking for support. What you've done here will garner enough support for you. And as Bishop of Uyo Diocese, I'm so proud of this project. And I keep asking God to bless you, that you didn't forget your roots. This is your Nazareth. You know, Jesus was born in Nazareth. This is your Nazareth. You haven't forgotten your roots. You came here to clean up the place. Christ was born in a manger. I am sure when you were born here, it was a very simple, small place of no great significance. But see, it has all changed today, courtesy of your goodwill. And we thank you earnestly. We are much more grateful that you've dedicated this building to Sister Anne Ward. And I'm glad the medical missionaries of Mary are here representing her.
It has a spiritual meaning to me because I was delivered there in 1964 by Dr. Anne Ward. I think the population and the medical needs have far outstripped the facilities there. And that is why the governor has just taken his right steps at the right time to intervene to uplift the medical facilities there, and it is most welcome.
He's a real guy because he has seen rightfully how to touch the life of the people from the grassroots level. When it concerns health, I don't think there's any alternative to that. So health is wealth, and it's just life. Health is life. So if the governor can start by touching the people's life from this stage, it's laudable.
I visited the hospital early this year to visit a friend of mine that was hospitalized. The place was not like this. Coming again today, I am happy with what I've seen because the hospital is wearing a brand new look, better than what I saw the last time. And it's okay for the patients, it's comfortable, it's more serene. I want to say a very big thank you to the present administration. He has done marvelously to the people of the state. So I want to tell people to join him so that he can do more for the state.
Following on the heels of St. Luke's Hospital is the General Hospital Etinan, which has been holistically renovated with the hitherto moribund health institution wearing a refreshing look to the delight of all.
We are going to do something similar in 8 hospitals across the state, covering the 10 federal constituencies. The essence of this is because primary health care is with the local government, secondary health care is with the state government. We have a teaching hospital which is for tertiary health care services. We have a specialist hospital in Udom, which is quaternary hospital. So that is a referral hospital. And at the grassroots, we discover people die from Emir 4, which is simple secondary medical facilities should be able to do. The facilities you see here all came from the United States of America. They are 21st century state-of-the-art that we have here. Not even a single thing you see here that was got from the Far East. These are first-class medical equipment. I'm sure by the time you see it, you will be convinced. So by opening up this, our prayer is God to give us more resources. Because health is wealth. And we keep valuing the life of our people. Our slogan is, the life of any of our members is as important as the life of the government. So we don't overlook that at all. So this is bringing health care that is easily affordable to the grassroots. A whole lot of people here, pregnant women here, get health facilities here, get health services here, free of charge. And then children between the ages of 0 and 5. And also there are some that we have to do very concessionary just to keep this going. So this is part of the social services. And the mark-related anniversary of Akwa Ibom State, we have been launching across the entire state the secondary healthcare services that is of international standard and is affordable. Most of the facilities you see here, you might not even be able to find it in a teaching hospital, and I'm sure of that. The kind of beds that we have here are not found in teaching hospitals. You're welcome, sir. With this singular honor, I hereby invite you, sir, to commission this phase of secondary healthcare services across the state using this project as a contact for that. And with this, we reassure you, sir, we would take healthcare back to the grassroots. Use to bring it. And this is a project that really touches the lives of people that I really congratulate you all because this is the sort of thing that makes governance worthwhile. Because we're able to touch the lives of so many hundreds of thousands of people. And I'm really pleased that we've done this and we're doing this across the states, into other locations. I'm also excited to hear that the equipment is state of the art, that this is in the first century. There are several trained persons who will be operating the equipment. Congratulate you for this project. This is wonderful. I pray that the government will be able to complete all what we set out to complete, all the governments in the state. And so with that, I will commission this brief instruction, get us new equipment for the benefit of people of this community, Akwa Ibom State, as well as Nigeria, to the glory of God. Amen.
We really thank God for the effort of the governor, digital governor. He has been so good to the people of Akwa Ibom State. He has done very well in the renovating, doing a massive renovation work in General Hospital Etinan. This hospital has been brought back to life, bubbling with activity every morning, every day. The patients are happy in the ward, and the staff also are happy. We have equipments, we have functional materials to work with, and everybody, the doctors are happy, the nurses are happy, and working in a great hospital. Kudos to our able digital governor.
The nurses, they are very, very okay. They are very, very okay with us. They welcome us very well, and they have been taking care of my father. The hospital is very okay, though it's not a nice place for someone to come and stay. But our government, they are trying. They are trying. Our governor really tried, because this is not how the hospital were in those days. Because I can remember when we brought my mom to this hospital, it was not like this. But now when we came, every place is very, very okay. Even the bed, everything they keep here for the patients is very nice.
From the entrance of the hospital to the different units, there is a refreshing new ambience with the staff attending to the patients like never before.
We carry diagnosis, that is, we test people when they come to the lab. We do like malaria, typhoid tests, urinalysis, PT, that is pregnancy test. We do some routine tests like that. And we even do CD4. We do wider. We do CD4. We do full blood counts. We have machine for chemistry, but we don't have the reagents.
Nursing services and general patient care in this hospital, with the philosophy that the customer, our client this time around, should be made happy. And with that other philosophy that the customer, our patient, is king. So we do everything in our capacity, in our efforts, to see to it that our patients are not only well, but they are happy at the time they leave this hospital. So we really thank God for our able governor once again for that magnificent, magnanimity in doing a massive renovation, touching every unit, every department of this hospital. We have superb equipments in the theater. We have superb equipments, magnificent equipments here in the X-ray. Our lab is well furnished. The beds, if you get to the wards, the beds are magnificent. Patients love it. People like it. They like visiting this hospital. They love it, they like it. So we appreciate the governor. We also want to put in our best to see to it that the efforts of the governor is not in vain.
Young no they grow one day. Now we are planting, we are building. Bring your own idea, make we build Akwa Ibom State. Don't turn and stand and look. Don't sit and look. Don't talk and yeah. Meanwhile they do nothing, don't look and stand and say. They say I hear, they say. Have you gone to check whether the thing is true? My brother Akwa, Udom is walking. Hey, hashtag Udom is walking. Hashtag Udom is walking. Hey, hashtag Udom is walking. Development is a gradual process. Let's join our hands together with Governor Udom Emmanuel to build Akwa Ibom State.
Similar gesture has been extended to the General Hospital in Econo. The hospital, which for several years has been in a state of dilapidation, has equally been holistically renovated. The old structure, which houses several wards and other units, is wearing a new look, as workers were seen putting finishing touches for inauguration of the hospital. Electricity and pipe-borne water have been restored in the hospital. The mortuary building is nearing completion. New quarters are being built for junior and senior staff, while the landscaping and drainage have reached advanced stages of completion.
It's really again because even the time I'm been near me as a welder for construction, they get a tie cut. Get a corrugated where you're more record, but as of now, when I war, it's here war for water, patience, me wait on it. When I we get you don't get it, but Zana, we mamma out to me, you don't get it. So I'm very, very happy. Many members in my government, even myself with my job, I exposed because even that gate, I mean, dancing or that ram, young them in dancing through a go to my wagom, no approve, and I'm in to show my job to the boy. I said, I'm 2019, and that's what I said, no, you will.
My way, my sister, can now for walk at the York, shall for my York, it took more with you, which I sack. Some friend, Frefu, you two in the camper, a boy named Ibom for me. Boba said, young, at our color. You can look at one better more. Take a kitchen no for my Rakarantu.
On behalf of the people of Ikona, I still believe in the Udom shoe size, which is 1523. That's where we stand.
Not too long ago, Governor Emmanuel flagged off construction of General Hospital Itumbang. The project, when completed, is expected to service Uyo Metropolis and Ibom International Airport. The newly rehabilitated hospitals are complemented with state-of-the-art world-class equipment to put them in proper shape to attend to the healthcare needs of the citizens. To this end, the Akwa Ibom State Government has in the last 30 months imported and distributed over 25 containers of international standard medical equipment to secondary health institutions in the state. These include 2 ambulances equipped with best-in-class intensive care facilities. The Udom Emmanuel administration is unmistakably sensitive to the healthcare needs of the people. Hence, the inauguration of an emergency response training program comprising 25 doctors and 75 nurses. The team is equipped to provide interventions to emergencies.
We have imported 19, 6 are at the port, 25 containers out of 100 we are going to import. So we have a lofty plan. We have gone very far, we are doing fine. Emergency medical service is a very key component of any health service anywhere in the world. In our country and in our state inclusive, about 50% of people who have trauma, about 50% of those people die if there is no immediate response to pick up those people and take them to center for the treatment. And to establish that kind of service in the state is going to help a lot in saving lives and limbs. It's very expensive, but His Excellency has decided to handle it.
To curb medical tourism abroad, the immediate past administration in the state had built the Ibom Specialist Hospital at Itam. But in a bid to reposition the quaternary hospital and make it function optimally, the present administration has contracted a new management for the hospital.
I welcome all of you to this historic event, which symbolizes a steady march to provide our people with the best healthcare facility that can compete with anyone in the world. When I came in, I promised Akwa Ibom people that after uncommon transformation, there's going to be what we call sustainable development. And you can't discuss sustainable development if you don't talk about education, healthcare, security, safety, and by extension, you're talking about wealth creation, and then employment, industrialization, and the rest of them.
Many people also who are trained in these fields have left the shores of this land to other places because of insecurity. But today we are witnessing a facility that is secure, provided for in all aspects. And I think that the first occupants of this place and subsequent ones are very, very fortunate people that they have a governor like this who has made this possible.
Government's huge investment in the health sector is in line with the Udom administration's medical reforms. At a time when the nation's healthcare delivery system is in serious state of disrepair, the situation is different in Akwa Ibom State, as the sector is very highly favored. This is because Governor Udom Emmanuel understands that for his industrialization policy to be effective, the health of the people must be accorded top priority.
Want to go home? I'm from Akwa Ibom. In case you don't know, Akwa Ibom,
Welcome to the new Akwa Ibom State. Today, through God's divine mandate, Akwa Ibom is blessed with Governor Udom Emmanuel, who is committed to the industrialization of Akwa Ibom State, passionate in human capacity development and empowerment, creative in the area of agriculture, reliable in superior infrastructure, and focused on the Akwa Ibom project. Be part of the winning team. Come, let's build Akwa Ibom together.
The progress of this state lies in the unity and love we show to one another.